treatment and possibly a surgery, okay? Possibly. The issue is this is a big surgery. It is a big surgery. This mass is 13 centimeters, about 13 centimeters in the longest diameter on the left side. The kidney is only 10 to 11 centimeters, okay? So it's basically the size of the kidney.
Wow.
It's been probably growing there for I don't know how long, months, years, who knows? And I'm not sure if that is the cause of everything you're feeling, but it's definitely something found on the CAT scan.
So let me slow down for 1 second. So the mass is the same or larger than?
It's almost replaced the kidney. Basically what I'm saying is some masses, some tumors, we can cut out and save the kidney, right?
Right.
Or have someone hit it with a needle, burn it. That's usually for about 3 or 4 centimeters, about this big, right? This one is much bigger, about 3 or 4, 5 times bigger than that. Long story short, I think you'll get better from all this, right? Your numbers, you're breathing better, you need some antibiotics, they're treating you for an infection in the urine or maybe the lungs. But I gotta set you up with a urology oncologist, probably a team, a cancer doctor and a surgeon, right? The cancer doctor to figure out what it is and maybe to go through something called immunotherapy or it's not chemotherapy, but something like that to shrink it or take care of any of the lymph nodes first. And then a pretty big surgery, I'm not gonna lie, okay? I'm okay with being recorded. I need to make sure that does not go online. This is
No, this is only for her
This
because
is a major issue.
I understand. Listen, let me tell you, this is only going to be for her because she's not even taking it all in right now.
And I hate to jump in here, but
I know.
this is that.
I understand.
We've had patients post things on TikTok.
Yeah, I'm not
and
posting. I don't do any posting at all. I'm doing it for her because she's not going to be able to hear it.
It's a big mass. First things first, get you better here. Second thing, probably we're going to set you up with an oncologist, cancer doctor, okay? They deal not with the surgery, but with things that they can give through the veins to try to shrink things, to try to control things. The surgery, in my opinion, if you were my family member, mother, grandmother, sister, I would say this surgery should at least be considered at a big institution where they can do a big surgery, open surgery if needed. A lot of these can be done robotically, small incisions, minimally invasive. In fact, I do that. I do that surgery. I do surgeries sometimes this big. The problem is I've been staring at the CAT scan. This thing is pretty big and at the wrong location, at the upper part of the kidney, the upper part near the lung, near the spleen. So I think there could be a benefit to get it done in a place where they can open, do a bigger incision to cut everything out if they need to. It's just that we don't have the training, the equipment, the staff here to do that big surgery here. Okay, we're in Indiana Community Hospital. I think potentially you may need a tertiary care, advanced hospital where they do a lot of these big surgeries.
And what type of hospital are you
Usually
speaking of?
Piedmont, Atlanta, downtown, Emory, right? They are sometimes north side. They have those institutions. They sometimes have residents to help other doctors in the room. That's just my opinion for the surgery later on. We can do it here, but it's not something, it's like, hey, we can try doing it here and run into any problems and then what, you know? So that's what I want to make sure we're all on the same page.
So how would I find out?
Do you?
So that's a good question. Some people will say, hey, do we need a biopsy? In my opinion, I'm going to leave that to the oncologist, the cancer doctor. If it was just a urologist, if this was a smaller one, 6, 7 centimeters without lymph nodes in the belly, then sometimes we just go in and cut that out. We don't need a biopsy, right? We find out after the fact. The problem is this: there is possible spread into the lymph node, right, in the middle part of the belly, and the kidney is pretty darn big. The mass is pretty darn big. So I think it's going to need a combination team approach. So short term, I want to try to keep things very straightforward. Get the infection wherever it's from under control. Antibiotics make you feel better. Make sure you're breathing okay. Okay. Middle to long term, we get you hooked up with an oncologist. I'm happy to be your local urologist here, but I don't think we'll eventually be doing the major surgery here. Right? It will probably be
Question:
downtown.
do you do any surgeries outside of? So you only work
So
here?
yeah, we're kind of like
Okay.
community urologists around here.
Okay.
I hate to say it, if this tumor is on the bottom part of the kidney, away from the kidney, away from the lung, away from the spleen. I've actually run into these issues when I was training at a pretty advanced robotic institute. Those are the cases we ended up opening, cracking open a rib and cutting open, because we just can't reach around with the robot without potentially injuring the spleen and diaphragm, which is the lung. Sometimes they have a hand assist to pull it down. Right? So I think doing things like that may have an advantage to be done at a bigger hospital. But there's a few steps before that. Okay, so I wanted to make sure. I didn't want the medicine doctors to tell you about this possible diagnosis. Yes. This is something that's been going on for a while. This didn't happen overnight. Mm-hmm. I'm not sure it's directly related to everything here, but it's something definitely everyone needs to be.
So what would have been the symptoms for this?
Yeah, so it's mostly metastasis. If we let this go, and this is a cancer, right? Likely, mathematically looking at the pictures, it is likely a cancer. It would go to the lymph nodes, then the vein going into the heart and lungs, and you'll see a lot of spots on the lungs. They don't see that on the CT of the chest. That's good. But there is stuff in the lymph nodes that I need the oncologist to weigh in on. Okay.
Right, I said, what would have been the symptom?
Symptom of lung, shortness of breath, right? Which she does have, but then the CAT scan of the lungs, at least what the radiologist says, is the lungs look to be clear.
Right, but you said it didn't happen overnight. So what would have been the signs of, what would have been those signs? You said this didn't happen overnight.
It grows silently.
So it does grow silently. Okay, that was my question.
Yeah, typically. So let's say if this was like 3 or 4 centimeters smaller, you'd never feel it. You'd never feel anything, right? Maybe at 11, 12 centimeters, you feel a bit bulge here, some fullness, there is something there. I don't think a feel, but it doesn't change the fact that we saw this on the CAT scan. Okay? So once again, I like to repeat the overall plan. Short term, make sure that whatever infection's under control.
Yes.
Like breathing, that's important.
Yes.
Like, what's the point of going through a surgery if you can't even breathe? Right? Your heart and lungs have to be in good condition. Set medium term, the oncologist. And I think the medium to long term, I may have to set you guys up with a tertiary, with basically the advanced hospitals. Piedmont, Atlanta, Emory, Northside. There's another location at Cancer Treatment Center of America, now called City of Hope in Newton. I don't think they accept Humana. They have some insurance argument. They're a very good institution. Your surgeon can do those big surgeries. Do you mind if I take a quick feel here? Just a little bit. Yeah. Do you guys have any pain here? Some fullness pressure? It's just me. I mean, I know it's not comfortable for me to push in on that. Okay. All right, so that's that. Any questions, guys?
Other question.
Yeah.
So when she finished here, when they get everything else under control, they gonna send her out.
Yeah, so with a list of referrals, numbers, okay? The oncologist, I can't speak for them. I'll have the hospital guys check in with the oncologist to see if there's anything to do now. I'm not smart enough to be a cancer doctor or surgeon to cut things out. So they may at least get you in the system for that. But the referral downtown would be made after you get discharged. But the reason I'm here is making sure you guys are aware of this. It's not something that you're like.
When they talk about a mask,
Yeah, so that's the mass. This is the mass. This is the mass that I saw. And unfortunately, there's nothing like, we're not going to wheel you back for surgery night to take that out. That would be crazy. Like with issues breathing, with a huge surgery that we're not comfortable with. We'd only do that if, I've never had to do that in my career, to take out a kidney as an emergency, aside from trauma, which is like a car accident or gunshot. We've done that. But for cancer purposes, things have to be done correctly, with good knowledge beforehand, know what it is, optimize the health, make sure all the other doctors are on board. The cancer doctors, the medicine doctors, the heart doctors, the lung doctors. Okay, guys? But that's long term. Should go short term. Once again, 3 things. Get the numbers better, infection wherever it's from under control. Number 2, the cancer doctor. Number 3, the surgeon, eventually wherever, okay, one of the big hospitals who will take up the case. Now, once again, if it were smaller or farther down, happy to do it here, around here.
Right,
Okay,
right,
but it's
right.
just, I've been staring at the CAT scan. It's a little iffy, not gonna lie. It's pushing right all, on the screen and Any previous
But that's what I'm saying. She wouldn't. She would. That doesn't pain. That's
it
not
may have been, that's why I
painful.
felt it. She may feel a fullness there, or like there's a lump there, or it may affect her breathing on the left side. That could be affecting her breathing. Okay, but this didn't happen. This didn't grow overnight.
Right.
Typically, when I see
understand.
these things, months to years.
Right,
Months
I
to
take her
she-
to the
she-
doctor, everything.
Yeah, it's tough because we see this. People get a CAT scan or ultrasound for some other reason, like gallbladder, or like they have belly pain and they find other things like the kidney.
She don't even complain about it.
Yeah,
Right.
She eat, like this just happened recent when
yeah,
she like refusing food, don't want to drink, don't want to.
yeah.
When she eat, we go out and eat. She eat out. I cook dinner. I take her to the doctor. She got an appointment for a checkup right now.
Yeah, I mean, I hate to say it, that like, I'm glad we found it, right? Instead of just kicking the can down the road. I don't know where the fevers and the infection signs are coming from. Maybe the urine, maybe something else.
Yeah, they said
Yeah, she's got a UTI.
It could
They
be.
said the UTI is bad.
There are rare cases where it is from the tumor, like the body tries to fight it off. Right? They think it's like this dangerous thing, and they have a big immune response.
Yeah.
The problem is that there's no treatment to take that out, right? Which is
Yeah.
Cancer.
right now that's too much of a risk at this point.
Mm-hmm.
Okay, I'll leave all the information. So she's gonna get better, right? With the antibiotics and everything else on the discharge paperwork. There's a list of follow-ups. I'm not gonna guarantee it, but maybe they call the cancer doctor here, the oncologist, to
We
get involved.
requested them to
Yeah.
call her.
I don't own I'm not the hospital team. The hospital team, they're the captains of the ship. Dr. Patel, they call me, they call other doctors. I'll put it down in my recommendation. It may be reasonable to talk to a cancer doctor. I'll leave the biopsy to them, okay?
So they still gonna Toya. They still have to
Yeah.
come in, check it out.
But a lot of my families, with this new news, I come in here, and it's usually a frustrating conversation. They're like, I want to do everything from beginning to end in the hospital. That would be unfair to her, because sometimes it just takes the body time to heal from
Yes.
all this before
Right.
doing something big.
Right. Which is like I said. This is why this video is. It's
Yeah,
only
I
for
get
now.
it. I got some
I'm not
people-
even
I got
opposed
some
to it at
people who
all.
are like, whoa,
Yeah. Yeah. She's not gonna even remember anything you
But
said.
that's why I kept going to those three things.
Yeah.
Okay? We'll have a team with you. All right? Put everything back.
It's bigger than.
There are, I don't want to give false hope. There are rare cases. These are benign. Rare cases. But that wouldn't explain the lymph nodes. Right?
And
Benign.
lymph nodes are.
There's swellings in the middle of the belly where drains all the dangerous stuff, like cancer or infection. So she had a big tumor and a
lymph node.
Yeah.
Is that the blackness that I was seeing? I saw the lady on the with
No,
them.
that's
Oh.
not. It's very hard to see. Even I can see it. The radiologist had to point it out.
Okay.
So that's the plan, okay? I'll write everything down.
Yes.
I know it's late today, but that's, I
Okay.
wanted to make sure you guys knew
Yes.
instead
Thank you so
of
much.
just reading it on your my chart or whatever.
Yes. I appreciate
Okay.
it. Thank
Any
you.
previous operations in the belly?
She only had a breast reduction. Over 20
Who's
something.
that?
So it's just,
Oh,
I'm just thinking
don't you
potentially
tell her I
whoever's
gotta
doing
call
the
her back.
surgery.
The doctor's still in here.
Okay.
Tell her I'll
We'll
call her
figure it out,
back.
but I want to make sure we're all on the same page here, okay?
Yes, sir.
We got a good team here, so one step at a time. Infection, control the infection, urine, lung, wherever. Cancer team on board, and eventually we'll set you up with a good
Surgeon.
urology surgeon.
Yes.
Or there's a lot of good urology surgeons around, but it has to be,
Yeah.
I think, in a hospital where they can support that
Yeah.
type of operation.
Yeah.
Okay.
Zion.
Oh, hey, you.
Oh.
All right, guys.
Thank you.
All right, thank you.